Hello, my lovely anatomists and physiologists. We are ready to talk about one aspect of external respiration, which we said is our pulmonary ventilation. And remember, for me, I'm thinking here, oh, this is my breathing for pulmonary ventilation. Or we can talk about this as moving air in or out of the lungs. And specifically, remember, we're talking about the conducting portion. Okay. And we said that since we are talking about gases, we do have some gas laws to talk about that are actually describing how we're getting this movement. And in the case of the pulmonary ventilation, Boyles Law is our law that helps us to understand what is happening with our gases. Now we can talk about Boyles Law as the pressure of gas is inversely related to volume. And this is the Michele Glass rendition or version or description of Boyles Law. Pressure of gas is inversely related to volume. And what that means is opposite relationship. Inverse relationships are opposite relationships. So if you increase the volume, the space that's holding the gas, you decrease the pressure. If you increase the volume, you decrease the pressure. And these are, this is an inverse relationship and it goes both ways. So then if we flip those arrows around, if you decrease your volume, you're going to increase your pressure. Okay, so changing the volume changes the pressure. So let's highlight this here, increase volume, decrease pressure. Okay. And then the other piece of information we need to know is that gas is going to move from an area of high pressure to an area of low pressure. So first of all, we've determined that the volume affects the pressure of the gas. And then we know that gas is going to move from an area of high pressure to an area of low pressure. The other thing that we can remind ourselves about, so let me go back in time to this image here, where we talked about the lung wall. Excuse me. And we said that the visceral pleura is essentially connected to the parietal pleura because of the pleural fluid. And the parietal pleura is connected to the body wall. And the body wall is your skeletal muscle, your skeleton, your skin of your thoracic cage. And so what we're going to see happening is that we're going to actually change the volume of the whole thoracic cage. This will change the volume of the lung. And based on Boyles Law, when you change the volume of your lung, you're changing the pressure. And then we're going to see that will cause gas to move in or gas will move out. I have a diagram here taken from our OpenStax textbook. I've linked the chapter in the video description. Remember here, this is the first time that we're using these terms. We're going to use the term inspiration and the term expiration. So inspiration is talking about an inhale, and expiration is talking about exhale. And we can see in our diagram, if we follow the trace of the arrows, we can see the inhale or inspiration arrows going in. And then when we look at the exhale or expiration, we see that the air is going out. When we take a look at the diagram, what we're seeing happening is it's going to be the musculature of the thoracic cage that's going to change the volume of the lung. So during our inhale, you're going to increase the lung volume. When we talk about Boyles Law tells us that if you increase volume, you decrease the lung pressure. And so what this means is your lung pressure, the pressure inside your lung, the intrapulmonary pressure is less than the atmospheric pressure. And so this creates like a pull to get the air in. So I'm going to write this word like pull in quotation marks in the lung. So when we make our lung bigger, the pressure goes down, so air goes in. And the reverse of this is happening in expiration or the exhale. So in the exhale, you're going to decrease your lung volume. And we know based on Boyles Law that if we decrease the volume, we're increasing the lung pressure or the intrapulmonary pressure. And then we know that gases go from a high pressure to a low pressure. So when we decrease the volume, of our lungs, we increase the pressure, and I'm going to write the word push in quotation marks here. We're basically like pushing the air out. Now, as we look at these two diagrams, what we'll see is the muscles involved. The muscles involved are the external intercostal muscle and the diaphragm in both cases. And what I want you to do is pay attention to that diaphragm. And if you'd like, you can imagine your diaphragm as like a tortilla. So imagine your diaphragm as like a tortilla. So in the case of the inhale, notice that the diaphragm is widening. So it's flattening out and it's pushing down into the abdominopelvic cavity. And then the external intercostals are making that rib cage out. So the thoracic cage is bigger because it's flattening and moving down into the abdominopelvic cavity. And then the thoracic cage is pushing out. And so that's pulling the air in. If we're imagining our diaphragm to be like a tortilla, when we see that the diaphragm relaxes, it's doming up like an umbrella, or since it's a tortilla, we're going to do like a taco shape. And so when it's doing this taco shape, it's making that thoracic cage smaller because now it's like raising up into that thoracic cavity more. And then the external intercostals are relaxing also. So the whole rib cage drops down. And so we get a much smaller thoracic cage in this case. Okay. We can feel this happening. Okay, so let's do a little bit of a breathing practice just to sort of feel this in our body. So take one hand and put it on your chest, anywhere, and then the other hand put it on your abdomen. And what I'd like you to do is take just a few inhales and then exhales. And you can see and feel your rib cage, thoracic cage getting bigger. And then you can feel the changes happening in your abdominopelvic cavity as well. Now remember, when we talk about the diaphragm, I said when you're doing your inhale, the diaphragm is going to flatten and push down. So it's going to flatten out and push down. And then that's like the tortilla. And then when we're doing our exhale, it's going to dome up as sort of like that taco shape, right? So it's going to flatten and go down in the inhale, and then it's going to like taco up in the exhale. But you can feel this also in your body. So take your hands on either side of your rib cage. So you've got a thumb on the back. And then do your inhale and exhale. And you can feel and maybe see that your thoracic cage is also like pushing further out.
And that's coming from that diaphragm flattening out and pushing down into your abdominopelvic cavity. And then you can feel kind of that thoracic cage coming back more into the midline as that diaphragm goes into like that taco type shape during the exhale.
When we are talking about skeletal muscles that are involved in pulmonary ventilation, we do see that there's different muscles involved in our inspiration or inhale and our expiration or exhale. We can talk about the inhale muscles as inspiratory muscles. We can talk about the exhale muscles as expiratory muscles. And then we'll see that there's different muscles recruited based on the type of breathing that we want to do. So let's look first at our quiet breathing, or you can talk about it as eupnea. And in the case of the quiet breathing, this is just like your resting normal kind of breathing. Okay. And what we'll see, these are the muscles we were just talking about. What we will see on our inspiratory muscles, we're going to see the diaphragm, and we'll see the external intercostals. And the diaphragm, remember, is that tortilla shape, right? So it's going to flatten and push down into the abdominopelvic cavity, making a deeper kind of a breath. And then the external intercostal is going to pull out on the rib cage. And so that's going to make more of a shallow kind of breath. So in the case of your diaphragmatic breathing, this is giving you a deeper breath. So you're pulling that air down deeper into the lung. And in the case of the external intercostal, this is going to give you more of a shallow sort of breath, right? And this should make sense a little bit. What we see on the quiet exhale is that we can talk about this as totally passive. The muscles relax. I'm going to call them primary inspiratory muscles relax. So primary inspiratory muscles would be your diaphragm and your external intercostals. Your primary type of breathing is going to be your quiet breathing. And so these are the muscles that contract for your inhale and relax for your exhale. And that's your regular, quiet, in and out pulmonary ventilation. When we talk about forced breathing, we can talk about this as hyperpnea. And hyperpnea is going to happen when you need to increase the depth and rate of ventilation. And maybe this is because you are doing exercise, or maybe this is because you're singing or talking loud. I'm going to say loud talking, right? So you're projecting a lot. You need a little bit more air for that. You might see this as a symptom of disease if you're having trouble getting the air moving in and out of the body at the quiet breathing. This could also be like thoughts of activity or thoughts of stress can trigger this also. Now here we talk about these muscles that are involved in the forced breathing as, I'm going to use this color here to say accessory muscles. Or if you wanted to, you could think about them as secondary muscles, right? So all of the muscles involved in the forced breathing are accessory or secondary muscles. And so we're going to have accessory inspiratory muscles and then accessory expiratory muscles. And so when we look at our accessory inspiratory muscles or secondary inspiratory muscles, we're going to see sternocleidomastoid. These are all going to be muscles that will make the thoracic cage larger. Pectoralis minor, serratus anterior, and then there's a muscle, I'm going to put it in parentheses, descalines. This is not a muscle that we talk about in our anatomy and physiology part 1, so it's not one I'll test on here, but I do want to list it. Sternocleidomastoid, pectoralis minor, serratus anterior. These are all going to help us lift up on the rib cage, separate those ribs, and really give us a bigger rib cage. If you do that practice again, where you put your hands on your thoracic cage, kind of hugging around in this way, and then you do your inhale, you may even be able to feel some separation happening in those ribs from these muscles. When we talk about the forced exhale, the accessory expiratory muscles or secondary expiratory muscles, we're going to see muscles of the abdominal cavity primarily. So we have internal and external obliques. We have the rectus, abdominis. We have the internal intercostals. So you do need to keep the intercostals separate in your mind because we had external intercostal as a primary inspiratory. So make sure you're keeping track. And then again, I'm going to put this one in parentheses because we've never really talked about it before, but you can also include here the transverse thoracis. And again, I won't test on that because it's not already in our wheelhouse of knowledge, but I'm going to go ahead and list it for you. If you again do that practice where you put a hand on your chest and a hand on your belly, and you do a forced inhale and then a forced exhale, you can feel the muscle contraction that's happening with your abdominopelvic cavity, with the rectus abdominis, internal, external oblique. What you're doing there is you're pulling down really hard on that thoracic cage, dramatically reducing the volume in order to pull the air in. So let's add that next one more piece of information. When we talk about our inhale, when we talk about the inhale, we're going to, it's not visible, increase our thoracic, let me say increase our, thoracic cage. And then when we talk about our exhale, we're going to decrease the thoracic cage. Where Boyles Law, remember, says when you increase volume, you decrease pressure. And then we already said that gases move from a high pressure to low pressure. Up next, we're going to talk about your lung volume. So how much air can you actually move? And also then lung capacity, how much air can your lung actually hold? So stay tuned. As always, take care of yourselves and each other.